Hello, everyone. Today I am going to talk with you a little bit about intellectual and cognitive functioning. And specifically, we're going to be talking about IQ testing, and we're also going to be talking about neuropsychological assessment. There we go. So the things that we're going to focus on, like I said, IQ testing and neuropsychological assessment, and we're going to talk about some changes in brain functioning that we see as we go along with that. So let's get into the interesting history. This is the history of IQ testing. And if we're looking at it, this can be traced all the way back to the late 19th and early 20th centuries. And there's roots in the field of psychology and efforts to measure human intelligence. So here's kind of a little concise overview. So the early beginnings were in the late 19th century. And the concept of IQ measurements, it dates back all the way to the late 1800s with a guy named Francis Galton. He was a British scientist, and you may be interested to know, he is the cousin of Charles Darwin. And he was one of the earliest proponents of measuring human intelligence. He explored the idea of using various tests to quantify intellectual abilities. So next comes up our friend Alfred Binet. And this is really the birth of IQ testing, and that's in the early 20th century. So in that time, French psychologist Alfred Binet, along with his collaborator, Theodore Simon, developed one of the first IQ tests to identify students in need of educational assistance. And so that became known as the Binet-Simon scale. And it was introduced in 1905, and it assessed mental abilities using tasks. So they were checking out students' reasoning, their memory, and their problem solving. And so that became known as the Stanford Binet test in 1916. Then there was a guy named Louis Terman, and he was an American psychologist. He adapted Binet's original test for use in the United States. So the Stanford Binet intelligence scales were first published in 1916. And as you know, it's one of the most widely used IQ tests that assess a person's cognitive abilities and provide a single score known as an intelligence quotient, or IQ. Then in 1939, we have the Wechsler intelligence scales. So David Wechsler, who was an American psychologist, he introduced a new type of IQ test. And this aimed to provide a more comprehensive assessment of intelligence. He felt like the original test, the Stanford Binet, was not hitting everything that needed to be hitting and identifying children that needed additional help. So he had the Wechsler Adults Intelligence Scale, which is the WAIS. He had the Wechsler Intelligence Scale for Children, known as the WISC, and these two were first published in 1939. The test introduced a deviation IQ score, where the average score is set at 100, and there is a standard deviation of 15. Then we move into the mid-20th century with standardization and norming. So IQ tests during this time underwent standardization and norming processes to ensure the consistency and accuracy in the measurement. So extensive research and revisions were conducted, and the reason that they did that was to establish standardized scoring and age-appropriate norms. So in the mid to late 20th century, there start to be some criticisms and some controversies. So IQ testing faced criticisms for potential cultural and socioeconomic biases, as well as for simplifying the complex concept of intelligence. So the critics were arguing that IQ tests may not be accurately capturing the full spectrum of human cognitive abilities, and that they can be influenced by various factors. I remember reading this once, and it was talking about how IQ tests are sometimes like I said, biased against certain people. And the test that they had were talking about gray tape. And it was like, what are ways that you would use gray tape in your life? And I had no idea. I was like, gray tape, what are they talking about? They were talking about duct tape, and how in some lower SES places that they use a lot of duct tape to hold things together. So see, I would not have scored well on that exam because I didn't know what they were talking about. So obviously this has happened with these, and it's a big problem. So on to the 21st century, and we have some modern developments. IQ tests are continuing to evolve, and with updated versions that are reflecting advancements in the understanding of human intelligence and incorporating improved methodologies. So modern IQ tests strive to address past criticism and to achieve greater fairness and accuracy in assessing intelligence across diverse populations. So this is something that we really need to look for and think about. So overall, the whole history of IQ testing is just like a fascinating journey in psychology, and it is showing advancements in measuring and understanding human cognitive abilities, which is great. Okay, so let's look at the definition of IQ testing. So IQ testing, as I said before, is short for intelligence quotient testing, and it is referring to a standardized method of assessing a person's cognitive abilities and their intellectual abilities. The aim of the IQ test is to measure various mental skills, looking again at reasoning, problem solving, memory comprehension, and analytical abilities. The resulting score that you get is known as the IQ, or intelligence quotient, and that's basically a numerical representation of a person's relative intellectual capacities when you compare them to a standardized group. So the IQ score itself is derived from a statistical comparison of an individual's performance on the test with the performance of a reference population, and that's normally shown to us as a bell curve. So the average IQ score within the reference population is set at 100, and the standard deviation is usually 15 points. So that means that 68% of the population falls within the range of 85 to 115 IQ points. IQ tests are designed to be objective and neutral, and attempting to measure inherent cognitive abilities rather than acquired knowledge. So the tests that they make are structured in a way that minimizes the influence of cultural, educational, and socioeconomic factors. But this always remains a challenge. And so efforts are always being made to reduce biases. So overall, what is it used for? IQ testing is used in various fields, and that includes psychology, education, employment, and to provide standardized assessments of an individual's cognitive abilities for the potential for certain types of things, such as academic or intellectual tasks. But it's important to interpret IQ scores with caution and notice that they're just one aspect of a person's abilities and potentials. So let's take a look at a timeline. So these are some key times and phases of IQ testing. So there's different models of intelligence, and they attempt to describe and explain the different aspects or components of human cognitive abilities. So through the history of psychology, there's been a whole lot of models that have been proposed to conceptualize and understand intelligence. And here's some of the top ones, and you can see these in your textbook as well. First one that we need to talk about is Spearman's two-factor theory. And this was created by a guy named Charles Spearman, and it's an early model, and it posits that intelligence is composed of a general factor known as G, and that influences performance across various cognitive tasks and specific factors, which are known as S, because they're specific to a particular task. The G factor represents an individual's overall cognitive ability. Next, we come up with Thurstone's multiple factor theory. This was made by Louis Thurstone, and his model suggests that intelligence is comprised of several primary mental abilities, including verbal comprehension, numerical ability, spatial visualization, memory, and reasoning. And so each ability is relatively independent and contributes to overall intelligence. Then we have Gardner, and he has a theory of multiple intelligences. Howard Gardner proposed that intelligence is not a unitary concept, but a collection of different types of intelligence. And he identified 8 multiple intelligences. And these are linguistic, logical, mathematical, spatial, musical, bodily, kinesthetic, interpersonal, intrapersonal, and naturalistic. Then we have Raymond Cattell and his fluid and crystallized intelligence. So his model distinguishes between fluid intelligence, which is the ability to solve novel problems and adapt to new situations, and crystallized intelligence, which is knowledge and skills that have been acquired through education and experiences. Now we'll take a look at Robert Sternberg's triarchic theory. His theory proposes 3 aspects of intelligence: analytical intelligence, academic problem solving, practice intelligence, which is real-world problem solving, and creative intelligence. And this is the ability to generate novel ideas and adapt to new situations. These components interact and contribute to an individual's overall intelligence. Then we have the Cattell-Horn-Carroll theory, or the CHC. And this is an extension of previous theories. And the CHC theory integrates Cattell's fluid and crystallized intelligence with John Horn's concept of a broad and narrow abilities. This model identifies various broad and specific cognitive abilities that contribute to intelligence. So all of this would not be possible if we didn't talk a little bit about Piaget and his cognitive development theory. As we all know, Jean Piaget, he was a Swiss psychologist, and he is known for his cognitive development theory. And this theory has profoundly influenced the field of psychology and education. His theory focuses on cognitive development of children and how they construct knowledge through stages of growth and experiences. So let's take a look. I'm just going to give you an overview of his cognitive development theory. First of all, we have the sensory motor stage. And this is when you are birth to 2 years. And during this stage, infants and toddlers explore the world through their senses and their actions. They learn about object permanence, which I think is neat. And that's the understanding that objects exist even when you can't see them. They are interested in cause and effect, and they start to develop their motor skills. Next up is the pre-operational stage, and that's 2 to 7 years. And in this stage, the kids start to develop symbolic thinking and language skills. They engage in pretend play, and they start to understand the viewpoints of others, but they still struggle with abstract logic and conservation, which is the understanding that a quantity remains the same even though there's changes in appearance. Next up is the concrete operational stage, which is 7 to 11 years. And children in this stage develop more logical thinking and a better understanding of conservation and reversibility. They can think more flexible, and they understand simple arithmetic operations, but abstract concepts remain challenging. And the formal operational stage, which is 11 years and older, the stage represents the ability to think abstractly, to reason hypothetically, and to consider multiple perspectives. Adolescents can engage in advanced problem solving, deductive reasoning, and critical thinking. So Piaget's theory emphasizes that children actively construct knowledge through their interactions with the environment, incorporating new experiences into their existing mental frameworks, their schemas, and he also highlighted the importance of social interaction and cultural influences in cognitive development. So these stages provide a temporary but a valuable framework for understanding cognitive development. So if we look at his stages of cognitive development, we look at the past theories that have come out from the people that we just talked about, you are kind of seeing how maybe over time people would score differently on intelligence testing depending on how it is set up. Now, what about nonverbal testing? Say you have someone who has nonverbal skills. These intelligence tests are assessments that are designed to measure a person's cognitive abilities without relying on language or verbal skills. These tests are really useful in assessing individuals who may have limited proficiency in the language being used or those who are having communication disorders. Nonverbal intelligence tests aim to measure reasoning, problem solving, spatial understanding, memory, and other cognitive abilities using nonverbal stimuli. So here are a few types of nonverbal IQ tests. The Kaufman Assessment Battery for Children, known as the KABC, and it's a comprehensive test that includes both verbal and nonverbal subtests. The nonverbal components, such as the Gestalt closure and matrix analogies, they assess a person's ability to perceive relationships and complete visual patterns. The Wechsler Nonverbal Scale of Ability, the WNV, is made by our good friend David Wechsler, and the test provides a nonverbal alternative to the traditional Wechsler intelligence test. It assesses a person's reasoning and problem-solving abilities using nonverbal, visual, and spatial tasks. So let's take a look at neuropsychological assessment. And this is a field that integrates principles of psychology and neuroscience to evaluate and understand how brain function relates to behavior and cognitive abilities. So let's go over just a concise history of neuropsychological assessment. The early beginnings started in the 19th century. Neuropsychology emerged in the 19th century with early observations of brain behavior relationships. So we had researchers like Paul Broca and Carl Wernicke, and they made significant contributions by linking specific brain regions to language function based on studies that they had done of patients with brain injuries. So then we move on to the late 19th to early 20th centuries. Here we saw advancements in understanding brain function localizations. So researchers like John Hewlings Jackson and Corbinian Brodmann, they made notable contributions to mapping brain regions and their functions. As we move on to the mid-20th century, there were advancements in neuroimaging and technologies like the electroencephalogram, the EEG, and the development of standardized neuropsychological tests that allowed for more systematic assessments of the brain behavior relationships. In the mid-20th century, we had World War I and World War II, and this brought a really big surge of interest in understanding brain injuries due to the large number of soldiers that had traumatic brain injuries. This increased the focus on brain trauma further, fueled with research into neuropsychology. In the late 20th century, we had, if I can say it right, Norman Geschwin. He was a neurologist and a psychiatrist, and he made significant contributions to neuropsychology by emphasizing the importance of the anatomical and functional relationships between brain structures and their role in cognitive and behavioral functions. In the late 20th century, again, we have cognitive neuropsychology, and it gained prominence. It was focusing on understanding cognitive processes by studying individuals with brain lesions. Researchers like Brenda Milner and Alexander Luria made foundational contributions to this field, which linked brain function and cognitive abilities. So as we move on, we have advancements in neuropsychology and neuroimaging in the late 20th century to the present. At this time, we saw a rapid advancement in neuroimaging techniques such as the magnetic resonance imaging, MRI, functional MRI, known as the fMRI, positron emission tomography, known as the PET, and the single photon emission computed tomography, or the SPECT. And these technologies revolutionized the study of brain function and greatly contributed to neuropsychological assessment. So now to the present. Presently, neuropsychological assessments involves interdisciplinary collaboration among psychologists, neurologists, psychiatrists, and other specialists. The field continues to evolve with ongoing advancements in neuroimaging, standardized neuropsychological tests, and a deeper understanding of brain behavior relationships. Today, neuropsychological assessment plays a crucial role in diagnosing and understanding various neurological and psychiatric conditions, guiding treatment plans, rehab strategies, and furthering our understanding of the brain's intricate functions. So I have a few final thoughts on the assessment of intellectual and cognitive functioning. There's some things that happen that they can't always be easily rectified in the scientific world. One of those is the thought that abuse of IQ testing and cognitive functioning has occurred. And this has been done to maintain the status quo. For example, brighter people who are better than those, they say, oh, brighter people are better than those who have musical ability. They may have a miscalculation of the intelligence of minorities, or they will have an overclassification of individuals who are learning disabled. We have some misguided tools that defend racial differences of ability. We have used IQ testing as a means to differentiate social classes. So when we come to conclusions, they should be done carefully and wisely and look at the whole person as well as the societal issues that are involved. All right, so that was a fascinating look at some neuropsychological, the IQ and cognitive functioning, intelligence testing, and neuropsychological assessment. So I hope that was enjoyable and absolutely fascinating for you. And always, if you have any questions, just send me an email at moon@ulm.edu.